Now I'm going to turn this over to Janice Reed, who is the president of the BNAA, the Barbados Nurses Association of America. Janice?
Thank you, Dr. Paris, and good afternoon, everyone. We just had almost an hour of an excellent presentation from our presenters, and we do have some questions in the chat, and I'll address the first question to Dr. Greaves. Dr. Greaves, this question came from Barrow-Laing, and the first question is, what is considered excessive CT scans? Dr. Greaves?
Right. So in terms of CT scans, in terms of excessive CT scans, let me frame it this way. Normally, in the US at least, exposure to sun and to soil, we are exposed to about 3 units, radiation units, which we call millisieverts, generally speaking, a year. The Arbor CT scan delivers anywhere from 7 to 10 units of radiation. It depends, of course, on the type of CT scan, but a typical chest CT scan or abdominal CT scan delivers about 8 to 10 units of radiation. Now, there are some trauma protocols where there's extensive workup in accidents where it can be 20 or 30. Generally speaking, we say that 10 CT scans, more than 10 CT scans a year is a concern, even fewer if there are more high intensity scans. What we do is that we look at the lifetime accumulation risk of radiation, which is like 100 radiation units is considered to be associated, greater than 100 units associated with the onset of radiation-induced cancers. Most commonly leukemias, particularly if the bone was exposed, or in people who've had many chest CTs, for example, breasts, and for people who've had many abdominal CTs, then things like colon, bladder. But in general, a single CT scan is very low in terms of the radiation that you get. It's not usually a worry, but I'd say 10 or so a year is concerning.
Thank you for that, those remarks and for that explanation.
Was there a second part to this question, or no, was that it?
No, that was it. Thank you. Thank you very much. The second question is another question for you, Dr. Greaves, and this question comes from Noah Brathwaite. And this question is, please explain breast cancer as a risk factor for ovarian and colon cancer and any other type of cancer.
Okay, so breast cancer is a risk factor in a sense for ovarian, colon, and other malignancies because of the shared genetic factors or genes. Most notably, they're all connected through their association with mutations in the BRCA1 and BRCA2 genes, which confers a high lifetime risk for breast cancer, ovarian, pancreatic, and prostate cancers, and a moderate risk of increase for colorectal cancer, particularly in younger women. So the association is there, but it's because of the common sharing of abnormal genes, particularly BRCA1 and BRCA2.
Thank you. We have a question for Dr. Laing. And Dr. Laing, this question comes from Dr. Paris. And the question is, with all the research going on, is the thinking that we might find a common final pathway to all cancers?
Thank you for the question. Well, I think there are at least 300 known signaling pathways in humans, and they're very complicated, interconnected, and complex. Oftentimes, when you block a pathway, there tends to be resistance because of activation through a different pathway. So I think that is a very difficult to be able to target holistically. Certainly, I think we would need perhaps to use some algorithms, perhaps through machine learning, to help to be able to determine if that's possible. Currently, it does not seem like that is possible. One of the most complete responses seen is with the reactivation of the immune cells through immunotherapies, and that currently has given the most robust efficacy.
Thank you. There's a question for Jessica. Comes from Dorette Edmonds, and she's asking if they're going to be meditation room, prayer spaces, or a chapel on site. Is that going to be built into the hospice that will be erected in Barbados?
Okay, great question. Thank you. Spiritual space, yes. You heard me make reference to a old mill wall. That is the space that I am identifying as the quote unquote chapel. Of course, subject to town planning approval, but that is very much a part of, and on the floor plan, we have a space which could be a private space, which in the early incarnation could be used for that private chapel type space. So the answer is yes.
And what other support services will you have? Will you have a social worker on site to support for the family members, maybe a counselor with that? I know you did mention nursing support services, but what other supported services will you have on site
All
in
of
addition?
those, yeah, all of those are part of the anticipated programming. Whether they would be permanent on staff or come in as needed is still to be worked out. That aspect of it is more, I don't want to throw that one to O'Neill, but more program specific. But those are the kinds of things that are standard in terms of hospice and palliative care facilities. We also, if I may add, interestingly enough, and OP may not tell you this, but he just started a palliative care program, and I hope to join him, because if you're working in something, you want to understand the nuts and bolts of it. Not that we may necessarily be hands-on, but there is provision in speaking with Dr. Natalie Greaves. There is provision for training of your volunteer people who want to be a part of, so that by the time the roof is on and the doors are open, we have a cadre of persons who are willing to volunteer their time. And again, you know, they call me a beggar. It's true. You have to ask for what you need. There's only two answers, a yes or a no. And so there are many persons who return to Barbados to live after living abroad and harnessing tremendous energies and services who want to be able to give back. In all of our lives, there comes a stage when you realize you can only spend so much on things, but how about giving a little of yourself? And there are people who want to do that. So provision is going to be made for that level of volunteerism. Worldwide, volunteerism is what helps keep the bills low in a hospice and palliative care setting. And we intend to use that sort of model as well. It doesn't mean we don't intend to pay, because of course, already in the conversation, nurses and so on who have to carry the brunt of the work. I'm advised that you really have a doctor in the house all the time, but on adds needs, but you always, always have nurses. If any of you knew Peggy Rickinson, who used to head up the Barbados nurses in Barbados years ago, she and I served in the Senate together. She used to say, doctors are nothing without nurses. Well, go figure.
Direct also to ask a follow-up question. Is mental health care, will mental health care be extended to the family members of those patients who will be obviously in the
that would
hospice?
be, mental health care, and I'm not a clinician, mental health care is a very wide statement, but I believe that Sincere made reference to the issue of bereavement, even before the loved one passes and following. So all services that make for the loved one who is transitioning to be as supported by the family will be made available.
Thank you, because bereavement will be very important post, so that will be really appreciated. There's a comment here. Let's see here. There's a post here to you, Jessica. So I love your exuberance and passion for this project, and thank you for your work. So
if I may just add to that, I don't think it's a secret now that I am considered a survivor. And when we talked a few minutes ago, I had ovarian cancer diagnosed last year, didn't waste any time, got on it right away, dealt with it. In other words, they recommended chemo, just did it. And there's a lot of life to live. So I had this passion before, but lo and behold, here I got it. So let me help somebody else get through the journey. So all that I need to do is to get going after the needs for those others. I was privileged to be here to be able to get it, the treatment I needed. But some Barbadians don't have the same quick and easy access. So thank you for the compliment. It's a moving train. O'Neill knows that.
I think with your involvement and having had a cancer journey yourself, whatever you have will be very impactful. I know you were sharing some things that you want to do in terms of in Barbados some of the some of the persons who are actually undergoing current chemotherapy right now, and your expertise and your compassion, your empathy, I'm sure will be quite valuable to those and impactful for those persons who you encounter. So thank you so much for sharing your journey. Okay, I think we've come to the end of our questions, and I'll turn it over back to Dr. Paris for a vote of thanks. Thank you all.